Hi YouTube, this is Kim here again, and this is Simplified Medicine. Today, we're going to talk about what is HPV and what is cervical cancer. Definition: HPV stands for human papillomavirus. It is a type of virus. It is STI, meaning sexually transmitted infections. You can pass on the virus from one person to another during the sexual intercourse. There are about 200 subtypes of HPV, 6, 11, 16, 18, and etc. The effects of the HPV varies according to the subtypes. So HPV 6 and 11 can cause warts in the anal area and the genitalia area. And the other problem is HPV 16 and HPV 18, which is very important as it can increase the risk of cervical cancer. So this is your female reproductive organ. Okay, you have your ovary here, you have a uterus here, you have your cervix here, small little cervix, and you have your vagina canal. As you can see, the surface lining of the cervix is a different name compared to that of the vagina. Right? This is columna, this is squamous. So when a girl hits puberty, you have a surge of estrogen hormones, which induces the cervix here to evert like that into a vagina. So it's exposing the columnar surface lining in the vagina, right? And it comes into contact with the environment of the vagina, which is acidic. This acidity can cause changes to the lining of the cervix into that of the squamous, right? So from columnar into squamous forms an area called transitional zone, which can be induced by HPV 16 and 18 to form cancer. How do we diagnose cervical cancer? So you have clinical features like bleeding, discharge, waterworks, right? Anything that makes the doctor suspecting of cervical cancer, and that leads to colposcopy, camera making way through inside the vaginal canal and have a look of the cervix, and to see the lesions, to identify it, and also biopsy, meaning taking a piece out and to assess it, to stage, meaning assess the severity of the lesions. How do we prevent cervical cancer? So we can offer HPV vaccinations. We do pap smear screening. Ladies, women age 25 to 64-year-old will be get in contact with to offer cervical screening. Reduce risk factors like stop smoking, control your number of partners. Treatment. It depends on the severity of the cervical cancer, but the treatment ranges from observation to hysterectomy. It's a type of surgery to remove the uterus, and chemotherapy. And this is all for today, explaining about HPV and cervical cancer. Do not forget to press like and subscribe.